Oh, nice. Okay. Good morning, everyone. Welcome to admin. Is there any, nope, roll call. Sorry.
That's okay. It looks like online, we have Cheryl Hartman, Christina Devar, Melissa Fisher, Michaeline Grimmett, Michelle Denman, Scott Wandler, Aaron Couts, and MCAT. In 206, we have Commissioner Vero and Strohmeyer, Jacob Allenton, Allison Franz, Carrie Powers, Ken Marshall, Maddie Scott, Annie Kathy, Chris Lounsbury, and Gina Miller.
Okay. Oh, and then
And Commissioner Slotnick.
Is there any public comment on items not on the agenda? Okay, consent agenda. Oh my goodness, 14 pieces. Anything that needs to be discussed separately?
That we approve the consent agenda. Second that.
Any further discussion or public comment? All in favor? Aye. Okay. Moving on to action items, Ken.
Griffin came last time specifically
Oh.
for this.
Oh.
And he's not here.
Oh, no.
Yeah.
You might watch online.
Oh, yeah.
Yeah, you're totally right.
Okay.
He could be on.
That's fair.
He'll watch.
He'll watch
He
after.
does it sometimes.
Yeah.
Yeah.
Yeah, so we have a new AI policy that we're looking to officially adopt. I spoke a little bit yesterday about it during our admin meeting, but this is a pretty standard, no nonsense policy that pretty tightly echoes the rest of state, local government, municipal government in adopting a policy to effectively limit liability around the use of AI for work product in local government.
Can you give an example? Just
Yeah, absolutely. So the thing about AI is that when you buy a product or a tool, unlike a lot of tools out there and software that you might use, AI produces product all on its own, right? Kind of magically. And you think about it from the perspective of self-driving cars.
Okay.
When a self-driving car gets in an accident, who's to blame?
Mm-hmm.
Is it the person who is operating that self-driving car? Is it the company who produces the software, the AI? Is it, is it whatever?
Yeah.
Whoever. Building a policy around AI helps limit our liability in the sense that we are one of the most common parts of an AI policy, at least within our sphere, is building ownership or basically tasking or assigning a human ownership of that. It's called human in the middle, right? We're asking that when you produce product with AI, we're requiring that when you produce product with AI, that somebody is taking ownership and responsibility for auditing that and saying, yep, I read it. This blurb, this book, whatever it might be, was produced by AI, but I've read it, I've edited it.
The thumbs up.
Yeah, I believe in it.
Got it. That makes sense.
And even more so when you get into weirder things like image generation or video generation, like that's even, like words, you carefully craft them and mold them, and it might kind of almost seem like it's your own. But images, that's almost whole product, wholesale, something that you're just accepting as yours or ours. So that is really important. And then of course, just putting boundaries around what we will use and will not use in the county and where our data goes and where our data can't go, because we're responsible for being good custodians of the data that we have. So, yeah.
Great.
Were you gonna say
I
something?
was gonna look at Jacob. Did you?
Sure.
Did you look at this?
I was thinking
or-
communication.
I did, yeah. I read it. And
Let's give Jacob the floor.
yeah, as far as piggybacking off what Ken said, I think another thing that's important, and I believe this was in the policy, but attribution that something is created with AI too. Like, yes, you want a human in the loop or in the middle, who is reviewing and saying, yeah, I attest to the accuracy of this, but also being transparent that AI was used and that you are not taking credit as that individual for the creation of it. And you are simply attesting to like, yeah, I was in a position of reviewing this. As Ken said, like the shift from like the old forms of like, I guess curative AI versus generative, where it truly is producing something that didn't exist previously. It's not just like pulling all of these different pieces of information together. It's like actually synthesizing something new from all of that. And why this is concerning, as Ken said, is when something goes wrong from a liability perspective, is it the human? Is it the creator of the software? Is it the platform? Is there some sort of, going back to like the self-driving car example, is liability attributable to the manufacturer of some sort of physical component related to that? Is it joint liability? Is it several liability? There are a lot of things to consider in this area. And like most things with the law, it develops much more slowly than technology does. And it's just way far behind in this space. So having something, at least like, since the law is relatively unsettled in this area due to the very rapid advancements and proliferation of this kind of technology, is it makes a lot of sense. And the best way that we can sort of protect ourselves is at least having, since we don't have that solid authority to rely on as of yet, that will probably be years to come. And by that point, it'll be essentially obsolete, as so often happens with the law, where it's like chasing those developments. So I did read the policy. It looks good. I think it's the best that we can do as of right now in terms of limiting our liability and trying to address some of those unanswered questions when it comes to how are you going to apportion liability in the event that there is an issue. So
Thanks.
Thank you. Anything else?
Yeah.
Okay, is there
Move to adopt a new policy. Second.
any further discussion or public comment? Okay, all in favor? Aye. Okay, public lands.
Yeah, I don't know if Commissioner Slotnick would like to talk about this. This came from a request to him.
Sure.
If not, I'm happy to.
Yeah, I can. The request came from City Councilman Eric Melson, who created a similar resolution for the city. Basically, this is a statement in support of our public lands, given that on the federal level, there's conversation about selling off public land. And we're just declaring our support for the existence of federal public lands.
Yeah, no, I think that's a great summary, and it basically just outlines, kind of the values that Missoula County has, especially around outdoor recreation and the ability for the public to be able to access both state and federal private lands. So.
Thank you, and thank you for crafting it, because a lot has changed
Thank
daily.
you.
So
Thank you, Allison.
thanks for keeping up with all of that.
Carrie and Chet and Randy also.
Yes.
Nice job, Carrie.
Thank you all.
Yeah. Good.
we approve the resolution.
Any,
Second that. Oh,
oh, yeah, you second. Any further discussion or public comment? Okay, all in favor? Aye. Historical Board, Museum Board.
Yes, this is a request to appoint a member to the Historical Museum Board for a partial term through December 31st of 2026. You met with Diane Sands, and that was the only applicant that we had, and this is to fill a seat that was added to the Historical Board a few months ago with bylaw changes.
we're really fortunate.
Oh,
Diane wants to do this.
Yeah.
And put Diane on the board. Sorry.
any further discussion or public comment? Okay, all in favor? Aye. We're lucky to have her.
Really?
Correspondence. Thank you.
Yeah, so we can cover a couple of letters here, Commissioners. So the first one is a letter. As you all are aware, the funding for the East Missoula reconstruction project on Highway 200 is one of the things that is up for removal under the Senate's current review of the Big Beautiful Bill Act. Which is the budget reconciliation process. And so we have a letter that you all signed on to that will go to the President and Senate soon that would request to move that from that particular funding source into one of the other funding options that would be available for that project. Letter number 1.
Yes, I think that letter has already been sent off to
Yep.
the senator. And I should just say the fate of Highway 200. The Highway 200 project hangs in the balance in the next hours or days. So for the 4th of July holiday, fate will likely be sealed.
So the second letter was a request, you received a request from the Condon, Swan Valley Community Council, the Condon area, to send a letter with passing on their comments and concerns around the construction of a new 275-foot cell tower in that area. And so that letter was transmitted electronically to the FCC during their public comment portal related to that tower's construction and the concern for the impact that it would have on the community, view shed, et cetera.
And I'm sure we did get a copy of that to the community council.
Yes, it was sent to the Condon Community Council, as was the East Missoula letter to the.
Great.
Or no, sorry, that one hasn't been sent yet. Next one is Frenchtown, which was sent to Frenchtown.
Thank you.
Well, Frenchtown.
So the last one was just and I was not part of this drafting of this particular letter. This particular letter was around the proposed truck stop out in the West Valley Community Council area out of Frenchtown. And Allison, I don't know if you want to mention anything about it, but it basically explains what the commission is.
Yeah, it just kind of,
Authorities and decision spaces.
right, it just outlines what you guys have authority over, what you don't, just how that process works, and also what communities can do to have a say in what growth looks like where they live.
That was a great letter.
Yeah, it was a really good letter.
I mean, it's something that should go to like
I feel like we're gonna.
the commissioners 101, at
We're gonna,
NACO.
yeah, we're gonna reuse it
Yeah.
Yeah.
again and again.
Yep.
And I'm excited in the sense that because of these new developments, some of our communities, outlying communities that had not considered zoning are now considering it and are more excited to be involved.
Okay, we're on to discussion items. We get to do sorry. Animal control or no?
I see a
Oh,
health director.
A
here.
health director. I was like, there's more than just animal control. Gina.
I'm here and I am sharing my screen. Let me. Okay, I also have 4 handouts, so y'all can fight over that 4th one. I know it's hot to presses. And I will be brief, so the handouts provide a lot more detail concerning the new requests that I will talk to you today about. Pins here. Remember that our mission is to build conditions that support the health of people, environments, and communities, and I hope that the new requests are reflective of that and include all of our core values. You will see there are several of them, and I just want to say, before I even get started, that as you all know, the funding for public health is really in jeopardy right now in lots of ways. These are the needs that we know today we need at the health department to continue to do a great job for the city and for the county, and also reflective of some positions that have been cut. And we also see that we're seeking other revenue, but the timing of that doesn't always add up in terms of our budget cycle. But in addition to these, there are several positions and programs at the health department that there's a lot of signals right now we are going to lose funding for in the coming fiscal year. So again, this is what we know about today, and I just don't be surprised if you see me back here in the coming 12 months talking about other things.
What's CIP again?
capital improvement.
Oh, thank you.
Remember, it's my first rodeo through the budget cycle, and so I wasn't sure if we were doing CIP requests today, so I'll just skip over that last one.
Process.
Child immunization program. Okay, so the first request has to do with the management restructure in our administration division. You'll remember when Damien was in the position, we created a director, administration director, and that was something we tried. A lot of benefits and some things that weren't completely working out in terms of span of control and just best practices. When that position was vacated, I met with the folks in administration division, with other directors, both in groups and individually, and talked about the right way to move forward with the management hierarchy and administration. And what I'm proposing is to take that one director position and split it into two managers. A business manager who would handle our contracts and finance and help with the budget and special projects and keep us really on track in those regards, accounting as well. And then cross-divisional programs manager. And that individual would oversee public health emergency preparedness, equity, communications, epidemiology, performance management, quality improvement, workforce development and accreditation. So administration is very broad, and I think what is going to work best, what we want to try is two managers overseeing about 5 and 7 people respectively. Of course, I have the budget for one right now. I advertised for the business manager a couple months ago. We had good applicants, but ultimately a failed recruitment because nobody was right for that job. Because I just wanted to shake it up, what's open right now for recruitment is cross-divisional programs manager. What I'm asking for is approval for the second. And you'll see on the right side there, the difference between having those two positions when compared with our previous FTE budget is about $60,000. And the theme to my presentation is that those costs are, the request is split 60% to the city, 40% to the county. The overall difference ongoing for the county would be about $24,000.
What does a cross-divisional program manager do?
They provide guidance and professional growth and leadership to, it would be 7. I moved emergency preparedness staff and programs under that umbrella to 7 staff. But they also keep us on track for accreditation. They make sure our communications and marketing is up to snuff. They're guiding our data collection and
KPIs.
technology, performance management,
How is
part of that.
How is all of that being handled right now?
I'm doing all of it right now. I'm desperate. Yes. New request 2 is for 2 full-time community health workers. These are staff that are at the department now, and their funding was grant funded for a number of years, and it was unexpectedly abruptly cut at the end of March. The county graciously agreed to keep those folks funded through the end of the fiscal year. But the community health worker position is something that we have a lot of faith in, a lot of pride surrounding the work that our community health workers are doing. And truthfully, it's kind of the way that public health is moving in a lot of ways, because these are, it's peer support in a little bit kind of different framework. So they walk alongside our most vulnerable community members and help them navigate all of these processes, which singularly are fairly complicated. And altogether, when folks are trying to take full advantage of the services and resources available, can be really overwhelming. So they help with housing applications, with nutrition and SNAP, Medicaid application and keeping insurance coverage. They help people sort of organize and navigate lives so that they can get to primary care appointments. And this program has been wildly popular. It has freed up our home visiting nurses in ways that they are very appreciative of. And over the grant cycle, we have had over well, now probably closer to 900 because I took these numbers in March, but at that time, 851 home visits or client visits. And they are going to all of our communities, into homes, into our shelters, into wherever people are at, and navigating some of those things with them. One cool thing about our community health workers is that we really try to get folks in that position who have some lived experience so that it really feels like peer support. We have applied for funding for both of these positions, the Community Assistance Fund and the Montana Healthcare Foundation grant. Both of those, if approved, would be one time. And so ideally we'll get them, and I would notify folks as soon as we know, and we would amend our request, of course. And then we'd probably be back here next year asking for the same thing. The total salary and fringe for both of these positions is $141,000 and some change, and then split between the city and county. The county's ongoing commitment would be about $57,000. The third new request might sound familiar to folks in this room because we ask for it a lot. Again, because of the timing. This is our foster child health program. And there's been a lot of kind of reallocation and partial coverage in this program as we try to braid funding together and keep this particular staff person doing the good work. So Montana, as you probably have heard, is third in the nation for foster care per capita. We have over 2,000 kids in care. There's a real need. Our foster child health program ensures that the basic medical needs for those vulnerable kids are met. And they do that by really connecting with their primary care provider, their foster parents, sometimes their birth parents, and the caseworker. And today, this program has served nearly 1,000 vulnerable children in our community, in Missoula City and County. Through mid-year fiscal year 25, we have had about 91 kids on our caseload. And again, we've applied for additional funding, both the Community Assistance Fund and also those opioid settlement dollars. The applications are being reviewed currently, and we just don't know if or how much of either of those applications will be approved. What we're asking for here is half an FTE. It's not that this person is half-time, but we have the other costs covered. In previous years, for a long time, it was covered by the Community Assistance Fund and also a fee-for-service contract with DPHHS. It does generate a little bit of revenue, about $40,000. It's by caseload. This is not a program where we want more caseload to bring in more revenue. We don't want more foster children in need. But there is some other monies coming in. Over the years, the dollars from the CAF were diminishing. And in 2021, we made the choice to reduce the hours for this particular staff person to kind of reflect that. But our caseloads are not diminishing, and this does warrant a full-time employee, and the ask is to cover the entire other half of that person's salary that's not covered by the DPHHS contract. Request 4 is a shelter attendant that is out at Animal Services. Of course, we have animal control and the officers and kind of the patrol and enforcement programs. We also have a shelter to run, and that shelter is getting bigger.
The first bullet, as our human population increases, so do our stray, surrender, and seizure numbers.
Yeah.
It sounds like of humans.
Oh my gosh. Yeah. Wow, I am not a very good wordsmith.
No,
Totally
fine.
understand.
And it kind of makes it seem like humans are having seizures, which is another health issue.
I've been
No.
mistaken for a stray myself.
Of course, what that means is we just have more pets here.
Of course.
Yeah. And they don't take a day off. We have to be out there 365 days a year, every day, caring and cleaning and making sure those animals have the basic needs met. We have 5 shelter attendants right now, and they work 10-hour days. If somebody's sick or on vacation, the only mechanism we have right now is that Holly Hargrove, our animal services manager, takes that on. And I have seen Holly many a Sunday at PetSmart. So it's not just at the shelter itself, but we have a auxiliary site where we have cats. That's been really beneficial to our cat adoptions, but it's another site to maintain. Of course, what that does is those folks are really committed to providing great care for those animals, but they also get burnt out when there is no other option but to show up kind of unexpectedly if somebody's sick and get that work done. It's an ever increasing task list with the same number of people, and we feel like, well, not as direct as some kind of revenue generation may seem. If we had another shelter attendant, we are hoping that it could indirectly generate additional revenue. We could have faster adoptions. We could have more diligent animal license follow-up, and it would free up our animal control manager to work on licensing initiatives or some other restructuring that she's considering. So a shelter attendant right now with salary and fringe is $63,123, and the county's portion ongoing would be just over $25,000. The fifth request, I know these dollars seem low. Again, this is my first foray through the budget process, but I think it's a good thing for us to just be really transparent about. We have a lot of grant funded positions at the health department, but most of those grants or ongoing contracts or mill levy dollars are stagnant. And what is not stagnant is personnel rate and operation costs. And so we have an ongoing grant for our communications officer. It's one person. The grant covers salary and fringe, and that grant total is $76,000, and it will be into the future. This is the first year that our specific employee in that position's pay has exceeded the grant. And so it's a small new request amount. But remember that the reason I'm being so specific with these numbers is because what I do with these numbers is I take one big package ask to the city and say, this is 60% of our non-grant funded personnel and operations costs. So I think for a long time, it just ends up getting paid and covered, but I'm trying to be really transparent, specific to that city ask about what it actually costs and what it means when grants don't change for 10 or 15 years.
How stable is this DPHHS funding for this position? It seems like low-hanging fruit to be eliminated by, I don't know.
Well, I mean, we are definitely asking that and trying to be strategically positioned and in the know and being able to predict or surmise what might happen. This is through the DPHHS, I believe, Office for Systems Improvement, and the grant is called Strengthening Public Health Workforce. It was born out of COVID times. When I connect each quarter with the grant manager at the state, she has seemed confident that this will continue at least for the next couple of years.
Is it very competitive, or is this automatic that it?
Mm-hmm. Yep, it's automatic. It was offered to counties during the pandemic. And, you know, I don't have an idea of how many counties took advantage of that. The amount is stagnant, and I think counties use it in different ways. We chose to use it for a communication specialist. That was, of course, helpful during the pandemic when we had such a public outreach need. But our strategic plan right now kind of maintains that as a priority. We really want to be a known, recognized entity in the community. Our brand is out there, our people are out there, and that we are communicating about what the health department does, what value we bring across the whole health department. And our communications officer is doing that in addition to coordinating a lot of our website activity. New request 6, I know it's not on the agenda because it's just brand new, and it's an easier one because we have new revenue coming in to cover it totally and then some.
Makes it much easier.
Yeah, I still like to talk about it. It's a win. House Bill 853 passed the legislature. We're very excited about that. That's to increase the license fees that, I would say for better or worse, but it's for worse, are in state law rather than, you know, an administrative program at the state or something like that. So it's an act of the legislature to have license fees increased. Those license fees don't come directly to the county. They're paid to the state, and a portion is reimbursed to the county if you do your inspections. license. And so this cycle is tough when the license fees get too low. So we do inspections, but the reimbursement is low. So we also cannot increase our workforce, improve the program, get our basic kind of bases covered. But this year we were successful in getting those license fees raised, and we're estimating that it'll bring in about $120,000 in new revenue. The license fees are on a calendar year, so we won't see that until January, but we are very confident that that new revenue will be there. A new sanitarian is the right investment because we are struggling to even maintain the services that we have been doing for a long time.
Would this person do licensed establishments and septics, or just one or the other?
Just one.
Okay.
So we have kind of a whole bunch of sanitarians, and this person would be focused on licensed establishments.
Great.
Yeah, yep. So of course, as it's commensurate to the number of licensed businesses increasing in our community, the need is increasing. The dollars were very stagnant for a long time, but we're happy to be in a different position and be able to afford this.
Are we fully staffed with this person then?
No,
Oh,
we are not fully staffed in that program right now. We had actually a couple resignations on a different team, and one person from that team moved internally. That's not uncommon. So we have a vacancy in that team. I think they're doing interviews on Friday. It's kind of a good market to be hiring in, but this is a brand new position.
There are sanitarians to be had in the broader world.
We often don't hire sanitarians to our sanitarian jobs. We hire people with so state law requires sanitarians to have a certain educational background in terms of credit hours, a science degree, and a certain number of credit hours in physical, chemical, and biological sciences. And then we train them. They work as a sanitarian in training for a year and then pass a national exam to be licensed.
Licensed establishments get recertified annually, is that correct? Or is it less or more than annually?
They relicense every year.
Every year.
Yes, they renew every year. They'll get, and that's all through the state administrative process, which is nice because that's a huge lift. But they get renewal notices in November. They are supposed to pay by the end of the year. Some of them pay into the next calendar year and then maybe have a late fee. The state keeps all of the late fee, but we get, depending on the program, 85 or 90% of that license fee back when we show that we've done an inspection.
Thanks.
Micah had a question for you, Jenna. Does the 77,456 include fringe?
Yes. Yes, it does. And in the handout, which I can send to you, Micah, it has the wage and fringe breakdown.
Does their pay go up after they pass the national test
Yes, it does.
by a good chunk or
Relative.
relative?
I
chunk?
mean, yes, they advance in the pay matrix.
Okay.
Yes. Skipping that, and the last point I'll make without taking up too much more time is that these are totals. This is across the city and county. To approve the base budget, of course, there's a personnel increase of 4%, but the new requests reflect a 5% increase from the base last year. And I think that, yes, that is my last slide.
What was the capital improvement request?
Oh, I'm asking for a remodel of the second floor for a number of reasons, but it sounds like, yeah. That sounds like
Do you know when you'll hear from the Healthcare Foundation?
I am not sure. I think the Community Assistance Fund has traditionally been late July or early August. I'm
We did
less
all our-
familiar with healthcare.
We did all our stuff. The notices won't come out, but we did all done.
Okay. I'm not sure about Healthcare Foundation. I know that the group of folks who are looking at the opioid dollars are meeting on July 18th to make recommendations to the decision-making body. So as happened last year, we got more dollars for our foster child health program from the CAF than we expected. And so we just came back to the city and the county and amended the request. We hope that happens again. And I forgot to include the animal control new truck. That one's pretty easy. We've had $30,000 in the budget for years and years. You'll see it, probably won't see it because I just stopped sharing, but we've had $30,000 in the budget forever. And I don't, forever is a defined term. We've decided that at the health department.
What's the, isn't there a technical definition, Chris, would know forever in world of government, it's like how many years or longer?
Oh, I have no idea.
I heard it said the other day.
But we can't get a new truck outfitted for that cost anymore, so we're increasing it by $20,000 to 50, which is a lot closer to the cost for a new truck.
Yeah.
Thank you.
Thank you.
Thanks. Oh, you guys changed seats in the ground.
I can say, I think we're toward the end of the meeting anyway. No, I'm gonna talk like 8 hours. Are you? Yeah.
Get a big glass of water.
I love your interview.
I don't know who needs a copy. There's probably an incorrect amount.
Thanks.
Well, hello, everybody. Thank you for having us. Thank you for hearing from us. So the budget enhancement request for the Community Justice Department is an extension of the FY25. So in FY25, we were asking for 3 FTE to help support the Crime Victim Advocate Division. Last year, you approved roughly half. It was slightly more once it all penciled out. And so this year, we're coming in asking for that second half. And so the total is $128,500. I realized as I was putting this together, that's in last year's dollars. So if we have the latitude to adjust that for the wage growth that builds in each year, then I would like to adjust that number. But based on conversations with, last year's conversation and how it was structured, I was just coming in with the leftover money from last year. I thought I'd give you some information about the program. You guys know this backwards and forwards, so this is more what's going on today. We're continuing to see roughly 1,600 people a year. In addition, there are about 780 walk-ins and calls. 25% of those folks become clients, but the rest are folks who are in the downtown area, don't know where to go, have questions, and look for services. And so our advocates do the care of clients as well as a lot of information referral to folks who don't know where else to go. Some of the other places that they do show up is in the courthouse. They go talk to court clerks and information desks. And, it's like when people don't know where to go, they'll go through any door. Our philosophy is you've come to the right door. We're going to get you to whatever services they are, even if they're not ours. So when folks call us, we are also spending time on things that are not exactly crime victim advocate services, but are also important for health and safety of community members. Largely, those are questions regarding housing. Sometimes it's around behavioral health or substance use issues. Never is it about parking. The complexity of the cases has been growing over the last many years. All of the things that have been hitting our community and society are the same things that we see in our clients. So the lasting impacts of the pandemic, the financial impacts, the inflation, all of that are things that when vulnerable people have even more things to struggle with, it makes that struggle even tougher to puzzle out. Some of the places where that shows up the most is houselessness is a major issue for clients, but especially when they have pets. On the flip side, there are a number of people who will stay for their pets, especially when the pets have been part of the pattern of abuse that is used to control people. So the person who's causing harm might not hurt you directly, but they hurt the pet in front of you and say, next time it's you, or they say, if you love this pet, you better stay. So pets become one of the tools of power and control and abuse. And it can be one of a significant factor for people staying, especially for larger animals. You know, it's much harder to find places for your horses or your mules. So those are the kinds of things that will take up a lot of time when our advocates are working with clients, because a safety plan isn't just what do you do if there's a moment of violence. It's how are you safety planning for yourself, your household, your kids, your pets. And with limited resources and increasing costs, that just becomes tougher. On the other hand, we do know that the services provided are meaningful and really help people. And I want to read this quote from a client. We get several of these, and it's usually spontaneous, right? It's at the end of a case, somebody sends a thank you. But this was to Celadina, who's the CBA manager. Tanya was so patient and insightful to my sensitive situation and my fragile frame of mind. She educated me, sat with me, and guided me down the path to reach the end point. Without a doubt, I can say my outcome and experience came solely from Tanya gently guiding me along the way. I could not have survived without her. Not always are they that profound, but sometimes. And when we're talking about people who are at risk of harm, at risk of injury, at risk of homicide, those are the kinds of things that you do want to hear. On the nuts and bolts side of things, we have, at this point, 9 FTE, 1 is manager, 8 are advocates. They serve both the city and the county. 5 of those advocates are co-located with justice system agencies. So there's 1 co-located with our sheriff's department, 1 with the police department, 2 in the city prosecutor's office, because that is where the vast majority of domestic violence cases are heard. The vast majority of domestic violence cases are misdemeanors, and given city, county, the vast majority are there. So that's, the caseload is high. And then we have Tanya, who is partnered with the county attorney's office.
They're physically co-located in those offices, or?
Everybody has space issues. And so Tanya is physically in our office, but goes over there quite a bit or is in court quite a bit. The PD advocate, yes. The sheriff's department advocate, yes. And then we were like, wait a second, we didn't talk through the move. And so actually, I'm not 100% sure if the advocate has space in the new offices, but we have cars. And I will say one of the, I guess, odd benefits of the pandemic was learning how much we could do virtually. And so while that advocate very much needs to be at the morning briefings and have some time with officers, there's a lot that they do either in court, in the field, or from their desks on the computer, because you can do so much virtually now. So the co-location is important, but not what it was pre-pandemic.
Chris, do you know, is there physical space in the new sheriff's office for an advocate?
There is not, I don't believe there's a like desk setup. They do have the soft interview room and those kinds of things. So.
Yeah, so puzzle through it.
What did you call it?
A soft interview room?
Not an interrogation.
It's not an interrogation.
Okay.
And
It
that's,
look like an interrogation.
As opposed to this.
There's a fixture over the bulb.
well, historically, that's where victim interviews did take place.
Oh, ouch,
And
ouch.
shocking that it didn't go well. I am proud to say our office had the first interview room that was meant for clients, as well as it was organized so that law enforcement could be their chairs to accommodate, sidearms. And then not long after, the sheriff's department created one in their office. And so the county really led the way on that. And across the state, it's still kind of a mixed bag, whether or not you're going to be in a soft interview room or a harsh interview room. So between an advocate having a space and there being a space that's comfortable for clients, I vote for space for clients all the time. Pressures on the funding. Costs go up. We've all been dealing with inflation and what that means for our workforce. And at the same time, funds outside of the county have been decreasing. One of our major sources of funding for the entirety of for like almost 40 years, VOCA grant had a 22% cut from the previous award to this one. And that is both cuts at the federal level as well as more organizations coming in for grant funds to the Board of Crime Control. But the effect is we have a 22% loss. Additionally, we've long relied on court fines and fees to help support the operation side of the crime victim advocates. And as those continue to dwindle, that also impacts us. So between loss of funds and increased costs, we have continued to need more and more hard funds to support this program. For the last several years, we have not increased staffing, but our caseloads are increasing. And part of that we have managed with reallocating a civil advocate to the CRIM cases. So as we've seen growth in CRIM cases, we were able to shift existing FTE. We don't have the latitude to make that kind of shift again if we continue to see the rise in the number of cases and the time it takes to handle those cases. So just bookmarking that for potential future conversation.
Is there a best practice for what the optimal caseload is that we should be shooting for?
That is a great question. Generally speaking, no, because advocacy grew up so organically across the nation. Programs really look different, and services look different. So if you're talking about like a shelter advocate, you're going to be limited by the number of beds, and there's only so many kids that fit in a house, kind of thing. But for the case management side, if you have a caseload that is high trauma, high behavioral health needs, there's substance use disorder, there's lack of housing, all of that, that caseload would be overloaded if there weren't also people who just are coming in for an order of protection and generally don't need longer, more supportive services. When we were tackling this in terms of burnout and ensuring that advocates had the support that they needed, that's when we invested in the manager position, who is a licensed clinical social worker and does clinical supervision. And so part of her role is ensuring balanced caseload with that sort of squishiness of there isn't a great guideline out there for all programs. So
Air traffic control.
care traffic control.
Care traffic.
Care traffic.
I am borrowing a phrase from Teresa Williams.
Okay.
Yeah. And her role has been very important. We have definitely seen, there have been sort of two tracks, some for advocates who have been with us a long time. There's been like one who promoted into a lead role and has been thriving. And with that support from Celadina that position has really developed. And then on the flip side, there's been some people as they complete their master's in social work and their licensure hours, then go off and become whatever they become, therapists usually, knowing that there's more therapists in our community who have this deep and ingrained understanding of intimate partner violence helps our entire community. So we are helping whether we're launching or growing. Really, this is the ongoing request for a program that's been here for about 40 years. Advocacy has always come up from the outside. It, started through agitation and some activism, and at a time when it wasn't even illegal for domestic violence to occur. And most recently, the kinds of changes, in the 90s, we finally decided that marital rape was also illegal. And the latest turns have been understanding that strangulation is an endemic part of domestic violence, very hard to investigate and prosecute. And we had to do better about it. And that was the last major statute change that really impacts the crimes associated with domestic violence. That has been another key part of our program. So in the state, CVAs have been leading voices there. And again, across the state, these services are not baked in like defense attorney or judge or attorney. So this is the long arc of trying to ensure that victims get the same fair treatment that everybody else does. Any questions? What's the protocol? Did we just run away now?
It's a hangout.
Well done.
Wait, Gina, with yours, your 6 requests, did you have them, are they in priority or does it?
They are not in priority order.
Is that even possible or is it?
I mean, it will have to be possible at some point or else.
It is.
I mean, when we're facing millions of dollars upside down here, it's at some point, we're going to have to make prioritization a thing.
You don't,
You don't have to say right now.
Yeah.
Sure.
Yeah.
Yes, and if there is additional discussion, what would be helpful is to know kind of the depth to it, to which to prioritize. If there were a dollar amount or a number of the 6 requests, then I could do that. If I had to pick one, I could do that. But I just feel like before I would rank them at all today, I might just want to talk about.
yeah,
Sure, yeah, take, you have plenty of time.
Thanks.
thank you.
Yeah.
Okay, events, invitations.
The East Missoula Social Listening.
Oh, thank you. Completely forgot about that. What time? Okay. Yes.
Yeah.
Swing through.
Thank you.
Okay. Thank you so much, Chantal.
5 to 7.
5.
7,
Okay.
The Lions.
Up the Lions Park.
we're with our park, Red Barn.
No.
Oh,
East
no,
Missoula.
the baseball park.
Well, the baseball.
Mount Jumbo School, East
Oh,
Missoula.
there we go, thank you.
Oh. Okay, yeah, thank you.
Do we have any admins for next week?
Yes, one on Tuesday.
Oh, okay.
And then
I won't be here, right?
I don't know the answer to that.
I don't know the answer either.
You will not be here, you will be,
I'm
Leadership
supposed to be,
Montana.
yeah, West Creek, yep,
yeah,
okay.
West Creek Ranch.
Oh, I gotta be there on, Monday? Leafda. Okay. I mean, no complaints, I just, I'd be ready.
Yeah, don't be bitching about the West. It is.
For free, for free. Anyone who's listening, yeah.
All right.
Okay, thank you.
Thanks,
Thank you.
everybody.
See ya.